The endocrine system and the connection between autoimmune Graves' disease diagnosis, hyperthyroid, and natural protocol. The endocrine system is a system of glands and their secretions that act within the body. The human body is under the control not only of the nervous system but also of a complementary system of hormones chemicals, which are released by specialized neurons or glands into the bloodstream or other areas of the body. These are released in response to situations or impulses or the normal cycles of the body and are not usually a product of conscious control, but are regulated automatically by the body itself. Their action is effectively much lower than that of the nervous system, but their effect is long-lasting, as the chemicals will continue circulating until they are broken down by the body. The pituitary gland is often called the master gland as it directs the activities of many other glands in the body.
The endocrinologist diagnosed her with symptoms of an autoimmune condition also known as Graves' disease from hyperthyroid. Graves' disease is an immune disorder that can affect thyroid hormones, hyperthyroidism. Thyroid hormones affect many body systems, so signs and symptoms of Graves' disease can be wide-ranging. The herbal blend can also help people who have hyperthyroidism, which are motherwort, bugleweed, and lemon balm. The thyroid gland is an important part of the endocrine. The thyroid gland regulates metabolism by releasing hormones into the bloodstream. Pituitary gland. Although the pituitary gland is situated within the cranium, it is part of the endocrine system rather than the nervous system. It has some neurosecretory cells that manufactures hormone to be released directly into the bloodstream, serving the anterior pituitary. This prompts the anterior pituitary to secrete its hormones and release them at the appropriate time. Some of these hormones are anterior pituitary hormones and posterior pituitary hormones.
Anterior pituitary hormones. 1. Growth hormone is released steadily throughout childhood with an extra spurt during adolescence, prompting the concurrent growth spurt. This is terminated in girls by the onset of menstruation and in boys by the increased production of testosterone. 2. Gonadotropic hormone controls the production of the male and female sex hormones by prompting the appropriate sex glands, testes in males and ovaries in females to produce their hormones. Thyrotropic hormone prompts the thyroid gland to secrete thyroxine, which controls the body's metabolic rate, which the body uses up food for fuel to produce activity. 4. Prolactin prompts the production of milk in pregnant and nursing mothers. 5. ACTH or adrenocorticotropic hormone signals the adrenal glands to produce their secretions. This is sometimes referred to as the stress or activity response.
Posterior pituitary hormones. The hormones of the posterior pituitary are manufactured in the hypothalamus but stored in the posterior pituitary. The instruction to release them into the bloodstream also comes from the hypothalamus. These hormones are oxytocin, the hormone that controls the release of milk and the contraction of the uterus during childbirth, and vasopressin or antidiuretic hormone regulates the output of the urine by the kidneys. Thyroid hormones are the one most important part of the endocrine system. If this affects, some symptoms may be suffer, like high blood pressure, too much nervousness, and sweating, just like in YouTube. The woman also went through high blood pressure, elevated heart rate, and became nervous and getting stressed and anxious in crowded people. Oxytocin is a hormone that's produced in the hypothalamus and released into the bloodstream by the pituitary gland, but it is a risk of taking herbs or supplements without a doctor's consent. It may affect your health. Glands are situated throughout the body. Each has a specific role, activity, and produces its specific secretions. The adrenal glands sit like three concerned hands on top of the kidneys. Their secretions are prompted by ACTH from the anterior pituitary gland.
There are two active parts of the adrenal gland. First, the adrenal medulla. The central area of the gland secretes adrenaline and noradrenaline needed by the body to assist physical activities. Both of these hormones are involved in a fight-or-flight syndrome, which is mediated by the autonomic nervous system. They also have a role to play in the physiological processes of emotions. Adrenaline acts on the heart muscle, prompting the heart to beat faster. This is one reason why athletes psych themselves up. They promote the flow of adrenaline by psychological means, which is then used by the body for physical purposes. Second, the adrenal cortex. The outer layers of the gland produces the corticosteroids, for example, cortisol and hydrocortisone, are utilized by the body for several physiological purposes, including the regulation of blood pressure. This is called into play during the fight-or-flight syndrome and also when the individual is under stress. Excess production of corticosteroids, for example, when an individual is under constant stress, is detrimental to the body because hypertension, raised blood pressure, and other physical changes they promote.
Pineal glands produce hormones that help regulate your immune system and blood pressure. But stressing about things like not having a baby may be your blood pressure or heart rate elevated and becoming nervous and suffering anxiety in crowded people. The pancreas. Cells in the pancreas produce insulin, which prompts the cells in the liver to break down glucose, simple sugar for use by the body or for storage as glycogen by the liver. The pancreas releases its insulin according to how much sugar has been ingested and how much exercise the person has taken to burn up the sugar. Diabetics with diabetes mellitus do not produce enough insulin for this process and have to inject themselves with insulin to top up their supply. They become adept at guessing how much insulin they need, bearing in mind their exercise and food balance, because all carbohydrates consumed are converted to sugar by the body. Warning behaviors for this may include unprovoked anger, irritation, or aggressiveness, because the brain is the first organ to respond behaviorally to a lack of sugar.
This is the term used for both male and female sex glands, the testes in males and the ovaries in females. The hormones they produce govern and differentiate male and female sexual and reproductive behavior. However, in humans especially, a great deal of the behavior is controlled by the central nervous system. We are not entirely at the mercy of our hormonal state. Most of the experimental work on neural hormonal connections has been carried out on animals, so we must be careful not to extrapolate directly to humans. In both sexes, there is an increase in the production of the sex hormones during adolescence, ready for the reproductive period of life. In males, androgens are produced which prompt physical changes such as growth of body hair, deepening of the voice, and increased in sexually oriented behavior, which is often culturally defined and limited.
In men, there are likely to be neural and cultural influences as well. A growth spurt in males occurs around the same time owing to extra production of growth hormone, whereas in female, the growth pattern in adolescence is much less marked and the onset of menstruation signals the decline of growth hormone secretion. The thyroid. The thyroid gland produces thyroxine, which influences the body's metabolic rate at which your body uses up food to produce energy. This influences behavior in that an overproduction of thyroxine accelerates metabolic rate, causing the individual to become highly active, jumpy, and nervy, which is coupled with weight loss. The underproduction of thyroxine leads to lethargy and weight gain. The pineal gland. In lower vertebrates such as sharks, frogs, and lizards, the pineal gland detects changes in levels of illumination. Hence, it is often referred to as the third eye. In humans, it secretes a hormone called melatonin, which is synthesized from serotonin. Melatonin is influential in the body's circadian rhythms, the daily cycle of sleeping and walking activities.
Other glands in human body. Other glands in human body produce secretion rather than hormones. For example, the salivary glands, which are first step in the chemical digestive chain of events. As mentioned in the previous chapter, the salivary glands are linked to NS, and the production of saliva is suspended in strong emotional states such as fear. Another gland that produces secretion rather than hormones but is linked to the reproductive cycle is the prostate in male. This is gland very rarely mentioned, yet it has important function. It manufactures the seminal fluid that surrounds the sperm. Probably because of human realize they have prostate gland cancer of the prostate are often ignored until too late.
Links with the CNS. The most evident relationship between the endocrine system and the CNS is that the hypothalamus regulates the pituitary gland, which in turn orchestrates most of the other glands, hence endocrine regulation can be traced back to the hypothalamus. The CNS receives input from hormonal levels, which decides whether glands are then encouraged to release or stop producing further hormones. This link is often called the hypothalamus-pituitary axis. Links with an ANS. The ANS causes the adrenal glands to release adrenaline glands at times of high emotion and when there is a demand for heightened physical activity. Through the thyroid gland, the ANS modulates metabolic rate. Links with the PNS. The skeletal system is linked directly to the CNS to perform voluntary movements through the PNS, which sends us impulses along axons to the limbs. The hypothalamus plays a significant role in the endocrine system. The function of the hypothalamus is to maintain your body's internal balance. So this stimulates the heart rate, the sleep cycle, and body temperature. It is involved in many functions because the endocrine and nervous systems are linked, such as consider receiving information to it. Thank you for watching, and we hope to see you again.